Hey, good morning. I'm Vic Senese with UroNurse News. Hey, be sure to like and subscribe. Today's story: the U.S. Food and Drug Administration has approved Truqap, also known as Capivasertib, in combination with abiraterone and prednisone for adults with PTEN-deficient metastatic androgen pathway modulation, naive, or sensitive prostate cancer. Now, if you're not sure what PTEN is, and boy, I wasn't, PTEN prostate cancer refers to prostate cancer in which the PTEN gene is lost or no longer functions properly. PTEN is one of the body's most important tumor suppressor genes. Its job is to keep cells from growing and dividing uncontrollably. See, you learned something today. This is the first FDA-approved targeted therapy specifically developed for patients with PTEN-deficient metastatic hormone-sensitive prostate cancer. The approval marks another important step towards precision medicine, where treatment is selected based on the unique genetic characteristics of a patient's cancer, rather than using the same approach for everyone. Let's take a closer look at what the approval means. PTEN is a tumor suppressor gene that normally helps regulate cell growth, which I taught you earlier. But when PTEN is lost or becomes inactive, cancer cells can grow aggressively by activating the AKT signaling pathway. Approximately 40 to 50% of men with advanced prostate cancer have PTEN loss, making it one of the most common genetic alterations seen in metastatic disease. According to Dr. Daniel George of the Duke Cancer Institute, patients with PTEN-deficient metastatic prostate cancer generally experience faster disease progression and have a less favorable prognosis than patients without this genetic alteration. That's why identifying PTEN deficiency has become increasingly important. Now, patients being considered for Truqap must first undergo testing utilizing the FDA-authorized Ventana PTEN immunohistochemistry assay, which identifies tumors that are PTEN deficient. This approval reinforces the growing role of biomarker testing in helping clinicians match the right therapy to the right patient. Now, the FDA approval was based on results from the international Phase 3 Capitello 281 trial, which enrolled more than 1,000 adults with newly diagnosed PTEN-deficient metastatic prostate cancer. All participants received standard hormonal therapy with abiraterone, prednisone, and ongoing androgen deprivation therapy, while half also received Truqap. The primary goal of the study was to measure radiographic progression-free survival, or the amount of time before the cancer worsened on imaging studies. Now, these results were encouraging. Patients receiving Truqap experienced a 19% reduction in the risk of disease progression or death compared with standard therapy alone. Median progression-free survival increased from 25.7 months to 33.2 months. Overall survival data are still being collected, so researchers will continue monitoring patients to determine whether this treatment also improves long-term survival. Now, before starting treatment, patients should undergo PTEN testing and have fasting blood glucose and hemoglobin A1C evaluated, since Truqap can cause significant hyperglycemia. All right, common side effects include increased blood sugar, diarrhea, fatigue, skin reactions, low potassium, anemia, elevated liver enzymes, changes in kidney function. Patients receive 400 milligrams twice daily for 4 consecutive days, followed by a 3-day off vacation while continuing their abiraterone, prednisone, and androgen deprivation, or after prior bilateral orchiectomy. Dose adjustments may be necessary for side effects or certain medications that affect the CYP3A enzyme system are being used. For oncology and urology teams, this approval represents another important advance in delivering personalized care based on tumor biology rather than the one-size-fits-all, or as I like to say, the hand grenade approach. The FDA approved the approval of Truqap offers a new targeted option for patients with PTEN-deficient metastatic prostate cancer, providing longer progression-free survival and highlighting the growing importance of precision oncology. Now, if you found today's update helpful, please like and subscribe and share this video to help us keep healthcare professionals and patients informed about the latest advances in urology. Thanks for watching. I'm Vic Senese, and this has been UroNurse News. Now, coming tonight on Dr. Jeff Talks About Sex and Intimacy, What if one of the most powerful relationship builders happens after intimacy? So, hey, be sure check out drjeffsextalk.com to learn more. We're going to be tonight at 7 p.m. Now, tomorrow on UroNurse News, something significant is coming to the world of medical imaging. A newly FDA-approved lower-dose gadolinium contrast agent is generating attention across radiology and urology, raising important questions about how we may soon balance image quality with patient safety in MRI diagnostics. Could this approval signal a shift in how contrast-enhanced imaging is performed in everyday clinical practice? Want to find out? Tune in tomorrow.
UroNurse News is where we meet. Online learning, technical and sweet. Every weekday, 9 a.m. Central Time.